Welcome to Kent County Benefits Open Enrollment presentation for 2019. This year's open enrollment will be held between October 15th and Wednesday, October 31st. During our presentation today, we'll talk about what is open enrollment, some changes that will occur to our benefits program in 2019, and also some programs that are available to you that you may not be aware of, but you might want to take advantage of. We'll help you to understand our health plan a little bit better, including the medical, prescription, dental, vision, life, disability, and the flexible spending accounts. What is open enrollment? Open enrollment is that one time a year where you can make changes to your benefits coverage. What type of coverages are we talking about? Well, maybe you have a family member that no longer needs coverage. You can go ahead and remove them. Or you have one that actually does need to be added to your plan. Now's the time to be able to make that happen. Or maybe you haven't signed up for, say, dental or vision in the past and you want to sign up for that. Again, that's the type of change we would like to see during open enrollment. Just keep in mind the changes that you request during open enrollment are not effective immediately. The changes will actually go into effect on January 1st, 2019, and they'll remain in effect for the entire calendar year unless you have a change of family status. If something happens and you do have a qualifying event, please let us know within 30 days of the event, and the benefits team will help walk you through the changes to the benefits that you want to make mid-year. For 2019, the payroll deductions and the wellness cash will start on the January 25th paycheck. There is one exception. The flexible spending account, if you sign up for it this year, will actually start on the January 11th paycheck. All of the benefits information is available online. If you go to accesskent.com/benefits, you will see all of the information you want to know about our benefits program and probably a little bit more. You can easily access this throughout the calendar year though, so just know that this is a website that's available year-round and not just during open enrollment. As we have done in several of the years in the past, we will not be mailing the packets to you because it is available to you online. And if you want to know what current benefits that you have available, we'll walk you through how you can find your benefits enrollment in the new A360 system. Open enrollment process is very simple. It's a 2-page form. If you're not making any changes, all you need to do is check the box that says no changes, fill in your name and employee ID number, sign it, and send it off to us. If you're wondering where you will find what your current benefits enrollment is, it's a pretty simple process. All you need to do is log into the A360 system and click on the kiosk that says Employee Self-Service. Once you're logged in, you will look across the top here to find the tab that says Benefits. And then once you're on that tab, look for the widget that says Benefits Enrollment. Once the benefits enrollment is opened, you'll be able to see all of the benefits programs that you are enrolled in, and it will outline it here. If you have a family member that's covered under the benefits programs, you can simply click on the dependent widget to get a list by the dependent name and what benefits they are actually covered under. Moving on, we just want to highlight some things that will be a little bit different in 2019 that we want to talk about. First, I just want to mention that we are not changing either the medical plans, the HMO and the PPO plan coverage will remain the same in 2019. For the HMO with Blue Care Network, however, there will be one slight difference. They are adding in a new group number, so they'll be sending anyone enrolled in the HMO plan a new insurance card. When you receive this insurance card, please start using the new one and destroy your old card. We don't want any billing issues by using the old group number, so please make sure those old cards get destroyed and are no longer used. Under the prescription plan, there's going to be a change to the out-of-pocket maximum. The out-of-pocket maximum is a combination of what we pay for our co-insurances as we get our prescriptions filled, and once we reach the maximum or the cap, we stop paying. So if we need additional prescriptions filled after we've paid copays that reach the cap, then we no longer pay for the remainder of the calendar year. If you have single coverage, that cap will be $4,750. If you have two-party or family coverage, that cap will be $9,500. Other than that, our prescription plan is remaining exactly the same. I do like to point out, however, that sometimes brand name copays change because they fall on or off the preferred list. Preferred list or the formulary list is what sets the copay rates. If the prescription for a brand name is on the list, then we pay $25 a month. If they're not on the list but it's a brand name medication, it's $45 a month. The one change that will affect anyone enrolled in our medical plans will be the amount that we actually pay for our coverage. Our medical and prescription costs in 2019 will be lower than what they are in 2018. So yes, we have the same exact coverage, but it costs us less in 2019. That sounds like a win to me. We are in a transition of changing the timing of deductions and wellness cash. Prior to the transition, we were taking everything 1 month in advance, and we're transitioning over to be current. During the month of August and September, you did notice that there were no health care deductions, and we had a little break from paying that. That was to transition the deductions from being 1 month in advance to current. During that time, however, we did continue to receive the wellness cash if we were eligible to receive it. The transition for the wellness cash will actually take place during December. So in the month of December, no wellness cash will be paid, but it will restart for the wellness cash that you earned in 2019 with the appropriate paycheck in January. A lot of our insurance companies offer more than just the regular benefits that we all know and understand. We kind of wanted to hit some of the highlights of some of those so that maybe you could be made aware of and take advantage of some of these additional services and offerings to you. For your convenience, additional information on these programs are on accesskent.com/benefits under the Value Added Programs section. If you have questions on any of these programs, please feel free to reach out to the insurance company that is offering the program. Have you ever been in a situation where you thought, boy, I'd really like to talk to a doctor about this, or I have a few questions I really want to talk to someone about? Good news. If you have a smartphone, you now have the capability to be able to video chat with a medical professional 24 hours a day, 7 days a week. And for a therapist or psychiatrist, you could pre-schedule an appointment with them and also have a video chat. This is being able to use the convenience of the cell phone, so you could do it from the convenience of your own home or anywhere you happen to be roaming with your phone. Just keep in mind when you use these services, the regular office visit copays would apply. The online office visits are very easy to use. You can either download the Blue Cross Blue Shield Online Visits app or go to the website bcbsmonlinevisits.com. Once you have the app open, all you need to do is provide the medical insurance information that is on your card, and you'll be able to connect and talk to a medical professional. Now, there may be times when maybe you don't need to talk to a doctor, but you would like to talk to a medical professional. Blue Cross Blue Shield and Blue Care Network offer a nurse line 24 hours a day, 7 days a week. You can talk to them just about maybe simple procedures or talk about maybe symptoms to see whether or not you should seek additional care. And the 24-hour nurse line service is available at no cost to us to use. When we do find ourselves with a more serious health condition or possibly a chronic condition that needs, ongoing attention, it's nice to know that we have additional assistance available to us through the care management program. They're there to help support us and make sure that we're receiving the proper treatment for our condition and also to answer any questions that we may have along the way. As you know, Kent County offers a wellness cash incentive if you're a non-smoker or if you're a smoker and trying to quit. Participating in the tobacco cessation program through our medical providers is one way to help you earn that wellness cash. If you're pregnant or even trying to get pregnant, this assistance program will probably be a good resource for you. It has a lot of tools and valuable information to answer a lot of the questions that you may have along the way. Smartphone users can download the Blue Cross Blue Shield mobile app. On that app, you can check all kinds of information. What is your coverage? What is your claims? One useful thing is if you don't have your insurance card, you can pull it up on the app and show it to the medical provider. You can also compare certain costs and check different quality standards for hospitals and doctors. Do you have an Amazon Alexa at home? Great. All you have to do is activate the MI Blue skills on Alexa, and Alexa will be able to help you with a lot of general healthcare questions, such as advice on how to quit smoking, looking for common explanations of what does a deductible mean. Have you ever found yourself wondering if there's a way to get a discount for a gym membership? Or maybe you're in need of a hearing aid and paying the full cost just seems overwhelming. There are a number of organizations that offer discounts through the Blue Cross Blue 365 program. This is just an example of some organizations that do offer discounts through Blue 365 program. These can change frequently, so what we recommend that you do is just sign up for the monthly updates through the Blue Cross and Blue Shield website, bcbsm.com. The Cigna Life Assistance Program is available to us when we just need a little bit of extra help just dealing with kind of things that happen in life. The My Secure Advantage is to help us with maybe our financial security, looking at some planning on finances and that. It also will help. It has an identity theft prevention and fraud assistance. So if we are a victim of identity theft, they have a program to help with that. And maybe you're just in need of writing a will, and it'll help with that program also. The Cigna Healthy Rewards is another discount area where we can get discounts on maybe vision, hearing aids, health centers, those type of programs. Cigna Assurance is for beneficiaries. If someone has a life insurance claim, to help the beneficiaries work through that process and receiving the benefit on that. And the Cigna Secure Travel is kind of a unique program. If you're traveling by more than 100 miles away from home, this program will help you. If there is a medical emergency, they can help you with that. And also can help you with some of your pre-planning. So if you're going out of the country and you need to know what visas or what immunizations do you need to have, they can help you with all of that also. If we're using a vision service plan provider, we can get additional discounts on lens enhancements. Say we're getting glare guard or scratch resistant to our glasses. If we're getting a second set of glasses, maybe we need just sunglasses instead of our regular glasses. Or if we're actually having laser surgery, we can get discounts available on that also. VSP actually offers discounts on more than just our glasses and contact lenses. We have discounts available for hearing aids, some health-related issues, entertainment, and more. To get details on all of the programs, go to vsp.com/offers. In addition to the discounts, VSP actually has an online website where you can purchase eyewear through them. It offers free shipping and returns, and it has a virtual try-on tool so you can actually see how you look in the frames before you buy them. We're going to move on now to start talking about the benefits program that Kent County does offer. It's important that you understand the differences between our two medical plans. We offer an HMO, a health maintenance organization, or a PPO, a preferred provider organization. And one of the key differences there is choosing the doctor. When you select an HMO, you have to choose up front who your primary care physician is. And that primary care physician will be the doctor that you will see for the large majority of the care that you receive. With a PPO, you do not need to make that selection in advance. And in fact, you can receive care from a different doctor anytime. As was mentioned, if you are in the HMO plan, the primary care physician will provide the majority of the medical treatment that you need. However, there are just going to be times when you do need to see a specialist. If you are in the HMO plan, please make sure that you have a referral from your primary care physician to the specialist. Without that referral, you will pay the full cost of the specialist services. Contrary to that, under the PPO plan, you do not need a referral to see a specialist and to have it covered under the benefit. Both the HMO and the PPO plans have network doctors. What that means is they have doctors and hospitals that have agreed to work for a discounted rate. Therefore, they're in network. For the HMO plan, you can only see medical providers that are in network. It does not cover for any doctors that have not agreed to those discounted rates. For the PPO plan, you can see any doctor, whether they're in network or out of network. However, if you see a doctor that hasn't agreed to the discounted rates and they're out of network, you will notice that you will pay more for those services. As I mentioned earlier, our medical plan coverage is not changing. It is remaining the same in 2019 as it was in 2018. Our office visit copays, specialist copays remain exactly the same. Keep in mind that if you're having a wellness exam, that does not cost us anything, and it is allowed one per calendar year. For any services not subject to the office visit copay, you would be responsible to start out paying the deductible. For the individual deductible under the HMO is $250. In network on the PPO, it's $300. And the two-party family deductible is twice that for both the HMO and the PPO. You'll also notice that the PPO has the out-of-network deductible, which again is a little bit higher. Once our deductibles have been met, then the co-insurance kicks in. You would be responsible to pay 10% of the bill for the HMO plan and 15% in network for the PPO plan. Again, a little bit higher if you're going to an out-of-network provider. What the good news is, we do have a safety valve that can help us to control costs. This is the individual and the two-party family out-of-pocket maximums. What the out-of-pocket maximum does is it combines all of the money that we have contributed for the office visit copays, towards the deductibles, and towards the coinsurance, and it adds them up. And once we reach the out-of-pocket maximum cap, then we no longer pay for any additional medical services that we receive for the balance of the calendar year. If you have individual coverage, that cap is $3,150. If you have two-party or family coverage, the in-network is $6,300, and on the PPO plan, it's twice that for the out-of-network doctors. Our prescription coverage is offered through an organization by the name of OptumRx. If you're taking generic medications for contraceptives, hypertension, diabetes, or prevention of breast cancer and certain conditions, then there's actually no copay for you to get that generic medication. All other generic medications cost $15. For brand name medications, they are divided up between whether it's brand name formulary or non-formulary. We talked a little bit earlier about that preferred drug list, which is the formulary list. If they're on the list, it's $25 a month. If they're not on the list, then it's $45 a month. One nice little hack that you might want to know about if you're on maintenance medication that you're going to be taking for an extended period of time, you can get 3 months supply of that medication for the cost of 2 by having the doctor write a 90-day supply. Our dental coverage is provided through VeriPro. Our plan allows for 2 checkups and cleanings per calendar year at no cost to us. Any other services provided under the dental plan would generally be covered at 50%. You are allowed to see any dentist anywhere. There are no restrictions as far as which dentist you go to. Instead since we're paying 50% for the dental services that aren't considered preventative, it's nice to know that we could get those available at a discounted rate. If your dentist is in the Aetna network, then they will provide the services at a discounted rate. You're not required to see a doctor that's in the dentist. You'll just pay the full cost versus the discounted rate. The dental plan does have a maximum. It is a family maximum. For KCDSA, this is for non-preventative services, a cap of $1,600. For all other employees, we have a family cap of $2,500, which provides for all services, including preventative. Under our vision coverage through VSP, you are allowed one exam at no cost once every 12 months. And if you're getting prescription glasses or contact lenses, you can update those once every 24 months with a copay. The county does provide life insurance for all of our employees. You can see the amounts here on this slide. This is available at no cost to the employee. If you choose, you can also purchase additional life insurance at your own expense up to $150,000. There are some rules that the insurance companies may apply for medical underwriting, so you have to be approved by them before your insurance would go into effect. As far as the rates and the details on the underwriting, please refer to our website. The county has a sickness and accident disability program for someone who just isn't medically able to work. There are a few exceptions for employment groups, so please check that out. But if you do qualify for the sickness and accident benefit, it will pay up to 67% of your base wages for up to 26 weeks. It'll start immediately if the condition is an accident or it's due to a hospitalization, and you'll have a 7-day waiting period if it's due to an illness. While the S&A benefit does pay for our disability if it's up to 6 months, we do recognize that there are sometimes medical conditions that last longer than that. The long-term disability program will cover any disability from the time it's extended at 6 months up to maybe age 65 if it continues for that long, and it will pay 60% of what our wages would be. Again, I note that not all employees are eligible for long-term disability. Please note on the right-hand side whether or not you are in one of those groups. The flexible spending accounts allow us the opportunity to set money aside on a pre-tax basis to cover certain expenses that we know we will have throughout the year. The first one is dependent care expenses. If you have children that are 12 or under and you're paying for daycare for them, you can set aside up to $5,000 a year on a pre-tax basis to cover the cost for the daycare services. The other option is for the healthcare spending account. Currently, the maximum is $2,650. Then you can set money aside to cover what our normal expenses would be. We talked about the deductibles and the co-pays and the co-insurances earlier when we were talking about our medical and prescription plans. Any expenses that we have under those plans, we could set money aside and get advantage of the pre-tax on that. Again, here's just some examples that we can use for our healthcare flexible spending account to take advantage of the pre-tax deductibles, co-insurance, eye exams if you're getting a new set of glasses, lab work, prescriptions, dental work. If you want a complete list of everything that would be covered by that, please check out the IRS publication that is addressed here. A couple of the things you need to understand when you're signing up for the flexible spending accounts. One, you must make an election every year. It will not automatically carry over from one year to the next. And two, you don't want to put aside too much money. Again, this should be for known expenses. If you put too much money aside and you don't have enough in expenses to get the reimbursement, you will lose that additional money that was taken out of your paycheck and you don't have a claim for it. Under the medical flexible spending account, what's really nice is we do have a 2.5-month grace period. Generally speaking, expenses have to incur in the year in which the deduction was taken out of our paychecks. Under the medical flexible spending account, we can actually incur an expense in the following year through March 15th and have that applied to the previous year. Let me give you an example. I set aside $1,000 in 2018 in my flexible spending account, but I only had medical claims in the amount of $800, which means I have a balance at the end of 2018 of $200 in my flexible spending account. If I go and get a new set of glasses in February of 2019 and I have to pay an additional $200 for that, I can turn that into my flexible spending account and withdraw the balance from my 2018 account because it was done before March 15th of the next year. As I mentioned, your flexible spending account does not carry over from year to year. Now, during open enrollment is your opportunity to sign up for your pre-tax deductions in 2019. Additionally, the wellness cash does not carry over from year to year, so you do need to turn in all new attestation forms. Now, if you're a little proactive and you had your exam prior to open enrollment and you turned in your wellness attestation form for the 2018 exam, you don't need to submit it again during open enrollment. We've got it. However, you do still need to fill in for being a non-smoker or trying to participate in a smoking cessation program in order to earn the wellness cash for non-smoking. There's a lot of information about what we just talked about, plus more at accesskent.com/benefits. But we recognize that you may just have questions that you can't find the answers to out there. So please, please, please contact HR. There's a number of ways that you can reach us. You can call extension 7440 and press option 5 for benefits. You can email us at hrbenefits@kentcountymi.gov. Or if you feel like it, just stop by. We're in the admin building on the second floor. We're generally available Monday through Friday, 8 to 5. Just keep in mind during open enrollment, we do need your forms received by HR by Wednesday, October 31st. Thank you for your time.